Hi, Mike. Thank you for agreeing to do this. As you know, I'm Stephanie. You hired me, and I just am doing a quick interview for one of my classes, so I appreciate it. So why don't you tell me a little bit about yourself?
Absolutely. So my name is Mike Tullis. My current title is Territory Manager of Hygiene Support here with Aspen Dental. I have been here at the company about 5 or so years now. And as far as like my dental hygiene career and path, I started out with my associates of hygiene and then went back and got my bachelor's a couple years later.
Nice. And where did you go to school?
So I went to school at Mississippi Delta Community College down in Mississippi, obviously in Mississippi. And then I went back to Ole Miss and got my bachelor's degree at the medical center.
Nice.
Yeah.
Nice. Well, good deal. Well, so real quick, just a couple questions. What do you do in your job? What does your job entail?
Absolutely. So my job is essentially clinical support. When people ask me these questions, it's always kind of tough, but essentially I'm almost like compliant. So I mentor, train, and hire other hygienists. So someone like we bring in a lot of new grads. So you're someone that I would work with and help, make sure you're getting your clinical skills under control, making sure you're staying up to date with all the guidelines and all the things you should be doing as far as diagnosing your patients. And there's a lot of also like back end admin work we do as well too, where we're keep track of metrics. We send emails a couple times a week, just updating with different updates, things like that. And yeah, that's the majority of my job that I do is just clinical support for the current hygienist.
Awesome. That sounds great. What education, experience, and/or preparation did you need to be hired for this job?
Absolutely. So, as far as being hired for this job, the only requirement you need is just your hygiene degree. As far as whether it being associates or a bachelor's, there's no really big difference in this position. I do feel like getting my bachelor's helped me out a lot with this because in my bachelor program, there was a lot of like critical thinking, writing tons of papers, things like that. So it got you to like think outside the box of the clinical hygienist. So getting your bachelor's, I think, is going to be a huge thing to help you get to this point. And then also to another thing that helped me in my career was when I became active in my professional organization, so the ADHA. So again, I was very active with SADA. Did that for a long time when I was in school, and then as soon as I came right out of school, I started working with the Memphis Dental Hygiene Association and was in many different positions in there. My first one was vice president, so I was actually in control of setting all the CEs for the year, inviting speakers, reaching out, building these connections, and as that happened, I just grew into the role and became president, president-elect, things like that. And then after that, I went into the state level, did all the same things I did at the local level in Memphis, at the state level for Tennessee. I was actually one of the things I'm most proud of was I was actually the youngest and first male ever president in the state. So it was actually really cool. And then I went to the national level and started working on committees in that way. And so it's honestly just working within, your network of hygienists, being in going to the CEs, talking to people, making sure you're making those connections is going to be the biggest thing that's going to help with this role.
Nice. That sounds great. So that was my next question: is what advice do you give to get for someone to get a similar position? So you
Absolutely.
kind of
So
touched on that a
yeah,
little
so
bit.
kind of touched on a little bit already, but yeah, exactly. That's the biggest thing, is that's what you need to do. You need to be able to network, think outside the box. Like a couple of weeks ago, I was at RDH Under One Roof, and so one of the things that I did, is just meeting all these different hygienists from across the nation. One of the things I was very lucky with, I got to do Unleashing Your Potential with the ADHA, where we were selected to go to a event in Chicago for a couple of days, I think, almost a week where we, hung out with other people that had leadership in their blood, kind of like you and I. We wanted to grow and mentor and become these people. And so you're putting in a room with all these amazing people and you get to meet them, learn from them, learn how they're doing stuff. And so one of the biggest things for me that got me into this position was meeting someone there. Like her name, I don't know if it's important, her name is Misty. So she works with Sage Dental down in Georgia. I met her in Chicago and she's what got me turned on to a DSO. Before meeting her, I was a private practice hygienist for the majority of my career until I joined Aspen 5 years ago. And the reason I joined the company was for a role like this. I wanted to move into this role where I can help educate more people and help people understand, that we are fighting disease, we're saving people's, lives essentially.
Yeah, yeah, absolutely. That sounds pretty exciting. What's your favorite part about all this?
My favorite part is actually working with all the different hygienists. Like we all went to different schools. Like I cover 4 or 5 different states. Honestly, I'm getting a new one pretty soon, so I forget if it's 4 or 5 at this exact moment. But like I cover from California all the way over to Colorado. So being able to go and meet all these different people and talking to them and learning how they learned something versus how I learned it. And then what's the best thing about that collaboration is bringing in what they've learned and what I've learned, and then bringing it to all of our other hygienists that didn't learn that. So it's like, we're always ever learning and ever growing. I
Yeah.
remember one of the first things that one of my doctors said in hygiene school the very first day is dentistry is a lifelong pursuit of learning. And it really is. The things that we learned 15 years ago in school are totally different from where we're learning now. So that's our biggest thing is just making sure that we're staying on top of this and meeting all our people.
Very nice. Well, I sure appreciate you taking time to meet with me for my project for school. I hope you have a nice trip. And yeah, and personal note, you've helped me a lot. So I appreciate
Thank
it.
you. Thank you so much. I appreciate you, Stephanie.
Thanks so much.
No problem.
See, stop video. I don't know how to stop. Do you
I
know how
got
to
you.
stop?
I stopped it.
You stopped? Oh, good.